I want you to imagine a specific moment. Maybe it's the searing pain that stabs like a knife with every little bump in the road or turn of the neck. Maybe it's the simple act of trying to pick up your grandchild. Maybe it's reaching for a coffee mug or trying to back the car out of the driveway. You anticipate the movement, but before you even finish, a bolt of lightning strikes the base of your skull and rips down through your shoulder blade. It is horrendous. It isn't just a dull ache, it is a system-wide crash. It prevents you from gardening, it ruins your sleep, and it has stripped the joy out of the activities you worked your whole life to enjoy. You've likely been to the physical therapist. You've likely tried the anti-inflammatories, the massage, the heat, the ice, and maybe even a quick fix cortisone shot that worked for 2 weeks before the pain came roaring back. You've been told it's just aging. You've been told it's just arthritis. I am Dr. Padda, and I am here to tell you that this is a failure of diagnostic logic. When your neck and shoulder pain keep you from the life you love, it is rarely just one thing. It is a structural collapse of your cervical-shoulder kinetic chain. And if you continue to treat this pain as a simple, isolated problem, you will never get your life back. We have to stop looking at the body as a collection of parts. The medical industrial complex loves to isolate symptoms because it makes billing easy. Consider the cervical facet joints, the zygapophyseal joints. These are the small joints that connect the vertebrae in your neck. They bear the load of your head. When they lose integrity, when they begin to degenerate, they don't just hurt in the neck. They send referred pain signals that often radiate directly into the shoulder girdle. Now, look at the shoulder. The rotator cuff, the subacromial bursa, the labrum, these structures are designed to function on a stable foundation. But if your cervical facets aren't providing that foundation, your shoulder is forced to compensate. The muscles in your rotator cuff are working double time, not because they are injured, but because they are trying to stabilize an unstable cervical spine. You are treating the shoulder because that's where you feel the pain, but the fire is actually burning in your neck. Conversely, we see patients with epidural inflammation, chemical radiculitis, where inflammatory cytokines are bathing the nerve roots exiting your spine. This chemical soup creates a hypersensitivity in the entire limb. Your shoulder feels like it's on fire, but the source is the nerve root in your neck. If you go to a clinic that only performs shoulder injections, you are treating the symptom, not the source. You need a total system audit. At Regen.md, we don't guess. We utilize a dual guidance protocol that is rare in the landscape of pain management. We combine fluoroscopy with high-resolution ultrasound. Fluoroscopy is the gold standard for spinal intervention. When we are targeting the cervical facets, we need the precision of real-time X-ray. I need to see the bony architecture, the dye spread, and the depth of the needle relative to the vertebral bodies with millimeter accuracy. This is the structural foundation of your movement. But fluoroscopy is bone-centric. It is blind to the soft tissues. It cannot see a rotator cuff tear. It cannot see the vascularity of an inflamed bursa. This is where the ultrasound comes in. This is our soft tissue microscope. With high-frequency ultrasound, I can visualize the rotator cuff and the surrounding musculature in real time as you move. I can see the exact spot where the collagen architecture is damaged. By combining these two modalities, we are effectively mapping the entire territory of your pain. We are visualizing the bony source and the soft tissue consequence in one cohesive diagnostic sweep. We don't just inject, we perform a targeted precision strike on the nodes of your pain generator. So, we have identified the source. We have the roadmap. Now, how do we fix it? We move away from the dampening paradigm of steroids. Steroids are catabolic. They break down tissue, they weaken collagen, they are literally eroding the structures you need to hold you together. We utilize orthobiologics, specifically platelet-rich plasma and bone marrow-derived regenerative cells. These are not just injections, these are signaling molecules. When I deliver these into the facet joint, I am modulating the environment. I am shifting the terrain from a chronic catabolic state, the state of pain and decay, to an anabolic state of repair. I am telling your body, this area is under distress. Here are the materials you need to rebuild. It is a biological tune-up. We are clearing the inflammatory mediators out of the epidural space. We are stabilizing the cervical facets. We are resetting the nervous system's sensitivity. I hear the argument from the insurance payers every day. They say, Dr. Padda, this is excessive. You are treating too many structures. My answer is simple. The body doesn't separate itself into CPT codes. The insurance model is designed to pay for temporary patches. It is designed to pay for the assembly line. One code, one injection, one patient, 10 minutes out the door. It is optimized to keep you in the loop of chronic management. I am not interested in that cycle. I am interested in clinical outcomes. I am interested in the fact that 12 months from now, you are back to your life. This requires a level of diagnostic and procedural expertise that is rarely found. Most clinics are either spine guys or joint guys. We are system guys. If you are currently trapped in the loop of horrendous neck pain, you have a choice. You can follow the assembly line. You can accept the steroid injections that weaken your tissue. You can accept the surgery that locks your spine in place. Or you can choose to fix the underlying terrain. Aging does not have to be painful. Arthritis is a treatable condition if you stop treating it as a final destination. The blueprint for your body is still there. Your tissues still have the capacity to heal, provided you give them the right environment and the right signal. If you are ready to stop chasing symptoms and start rebuilding your foundation, we are ready to help you. I am Dr. Padda. Welcome to Regen.md.